Welcome everybody to the first Tech Tuesdays of 2021. We have a pretty exciting series planned out for the whole year. And today we're going to start with an Innovator Showcase. The Tech Tuesdays is an event hosted by the Medical Center of the Americas Foundation. and as part of the program from the Innovation Center. The Innovation Center is an agent that drives, whose purpose is to drive a thriving culture of innovation in the Paso del Norte region. We do this by providing technology startups, companies with support they need to launch, scale, and grow in the Paso del Norte region. We enhance the biomedical device manufacturing ecosystem. We host events like this one, the Tech Tuesdays, to have impactful in the innovation community and to promote positive aspects of the innovation ecosystem. Our talk today is an innovation showcase featuring OTEN Medical. We have Ernesto Holguin and Rob Sanchez on the line. Ernesto Holguin is the CEO of OTEN Medical, a local El Paso startup that began working with the Medical Center of the Americas in 2017. Ernesto began his nursing career in the United States Army in 1993 as a combat medic and transitioned into a licensed practical nurse. There, he worked as a part-time in the hospital evacuation support for Belmont Medical Center in El Paso, Texas. He completed 3 years active duty and 6 years in the United States Army Reserve, finishing with an E5 sergeant ranking. In the civilian sector, Ernesto is a proven top performer with HCA Corporation, previously named Nurse of the Year. He is a goal-driven coordinator with over 25 years of intensive care nursing healthcare experience, certified nephrology nurse, nurse manager for 2 hospitals, policy writer for all dialysis modalities, and nurse innovator with 3 named medical patents. Ernesto started OTEN Medical in 2017, and is responsible for innovating remote diabetic food monitoring system, IV and ventilator holder and organizer. We'll talk about these products in a minute. And the CPAP host holder. Focused on fundraising, business development, presentations, prototyping, proof of concept, product development, and manufacturing. OTEN Medical has 2 hospital supply products in circulation and newly launched direct-to-consumer product. Ernesto holds a Bachelor of Science in Nursing from the University of Phoenix and is a certified nephrology nurse. Rob Sanchez is a healthcare software and device strategist, an executive that has completely successfully led and grown 3 startup companies after spending a decade working in business development roles for multi-billion-dollar medical device brands such as Medtronic, KCI, and Fitbit. Rob knows how to drive marketplace value and position brands for consumer and clinician adoption. Rob led and helped build a direction for Tupelo Life in Dallas, Texas. During his tenure as Chief Operating Officer, he partnered with the American Heart Association to secure IT services for their Center for Health Technology and Innovation, and helped to grow the company's home telemonitoring platform. In 2015, Rob founded Score More Funds, a school and sports fundraising. In 2018, Rob joined OTEN Medical as COO and co-founder. This is just the tip of the iceberg of what Ernesto and Rob will talk about this event. Thank you everyone else who has just recently joined. Let's start off. Ernesto, if you could tell us a bit about OTEN Medical, so everyone on the call can know a little bit more about you.
Sure. Good afternoon, everybody, and thank you for joining us. And thank you, Alberto and Nancy, for having us. Uh, I'm going to speak a little bit of the background of our business. So back 4 years now, I had won the local proof to concept competition at MCA back in July of 2017. So I had already been with MCA, taking some business courses here. They offer us very, in-depth talks on how to start and manage a business. So at this time, I only had one patent, and in order to lure down investors, I had to get my LLC. So as the pressure rose and the dream of my invention becoming a reality, I had to open up a business with a legit name. So by December of 2017, I had my LLC. And then, you guys keep in mind that, the dream of seeing my invention become a tangible platform that would ultimately help diabetics better monitor their foot ulcers without the need to physically see the doctor was my ultimate goal. And, oddly, with the COVID happening in 2020, a lot of the remote monitoring became real, became tangible. So I was working on this back in 2017.
Great, great, great. So that's a pretty substantial experience, a couple of years already working there. And that's how it all started with telemedical monitoring of diabetic. Right. Okay, great. So if I understand correctly, you currently have three different product lines, patents that you wanted to share. I'm gonna share the slides that you sent me.
Okay.
Could you tell us more about the story behind
Okay. So
the story behind each of the products, please?
Right. So this first product is, I have received a patent. It's the remote diabetic foot monitoring system. We call this product the DiFOBot, and it came back in light back in 2014. So I'll give you a little history on how I came up with that idea. So I'm a dialysis nurse, and back in 2014, I went to pick up a patient for a hemodialysis treatment. And this patient was a regular patient of mine. So she was a lovely, lovely lady with a good family support. I asked her, what happened? And in Spanish, she goes, "Mi hijo, tengo una úlcera en el pie." So meaning, son, I have a foot ulcer. So I asked her, well, don't you check your feet after each shower? And she said she can't bend over, or she can't even see her feet. So her vision was rather poor, secondary to her diabetes. So I asked her, what about your husband checking for you? And then she goes, honey, he's in the same boat as I am. And your children? And she proceeded to say that, they were busy with their own children and were not around after her showers. So I was curious. I asked her, well, how did you know you had a foot ulcer? And she said, I smelled it. So at this time, I realized that this person had to go through two senses, the sight and the sense of smell, in order to understand that there was something wrong with her foot. And that's how I came up with this idea, the remote diabetic foot monitoring. And it's a touchy subject because a lot of people are labeled or misconstrued that, they're being negligent with their care, or they're too lazy to do anything about it. But the reality is that they're victims of their diseases and are subjected to external assessments in order to properly care for themselves. Well, I did what any nurse does and, dug a little deeper into her activities of daily living and investigated what her challenges were. So I performed this with hundreds of times with all my renal patients that came for diabetic foot ulcers. And I realized that they all share the same problems and obstacles. So that's the first patent. Now the second one.
Now, before we continue, Ernie, if I could just comment, that's a very enlightening insight that you tell us. It's it's something that, again, as a nurse, you're very close to the patients, and you find out these sort of problems. How specifically did you decided that this is a problem that you wanted to tackle? I mean, as a nurse, I guess you get a bunch of different problems daily. And how did you decide to pursue this solution?
Well, I realized that, the patients were coming in within a month and a half, and usually after they're being physically seen by the doctor, and they were getting worse every time they were admitted. They went from, the taking antibiotics through the mouth to taking antibiotics through the vein, a little bit more a stronger type of treatment. And I just saw that the ulcer was getting worse and growing, and tunnel infections, and eventually they were being amputated. Unfortunately, a lot of them ended up with blood infections, sepsis, and ultimately took their lives. And I realized that the technology that we have right now as a society can be curtailed in order to properly monitor these patients at home. And if there's a change, a worsening wound, then we could attend to it quickly and be proactive about it and have them come to the doctor. And I realized that opportunity back in 2017, and or back in back when I first saw this lady in 2014, or 2004, and back then there was no smartphones. They came into light in 2007, so there was no remote monitoring. Well, there was, but not as publicly as today. But I had a vision that, what if we have something to monitor them at home, prevent this, better monitoring, not only for, high risk diabetics, or just for monitoring the existing wounds and see how well they progress, how well they improve throughout time. So I realized that there was a room for improvement in this area. And there's a lot of rooms, there's a lot of gaps in our healthcare system that do require attention to, and there's opportunity to invent and to innovate in these areas.
Okay, great. So you were talking about the next product?
Yes, this second product they have two designs that complement each other, and we also have patents on them. These we call the eye lines. And what it is, it's an intravenous and ventilator tube, which is the respirator for the patients that are intubated. These are holders and organizers. So it's for hospital uses, and its function is to keep the IV lines away from the floor and in nurses' eye view, away from clutching, away from pulling, tugging. So we developed this technology through trial and error, utilizing a 3D printer. We were able to manufacture these two products and have filled orders already. So the interesting point on this product is that they also assist by organizing the IV lines with the pumps outside the COVID rooms. And this decreases the need to enter the room frequently, because the nurses are able to manipulate the IV antibiotics, IV, vasopressors, anything that has to do with their intravenous medication regimen outside the room. And that reduces the use of PPE, the personal protective equipment, and the staff exposure. So these two products are a business to business product.
Okay. And this one, right?
Yes, that's the third and latest patent is the CPAP hose holder for home use. And we're really excited about this product, because we're launching this at the beginning of next month, February. So I'll give you a little bit of history. If people don't know what a CPAP machine is, it's a machine utilized by people with sleep apnea at home in order to better get rest at night, better breathe. It also deters them from secondary effects, which usually is cardiovascular problems with problems breathing at home. So with these, the holder, it keeps away from clutching on furniture, on your bed, on the bedside table, and allows for better movement within the bed and overall better night's rest. And again, this product, we 3D printed the parts and it was ready to be manufactured. We saved a ton of money doing that. I performed a series of product testing with subjects that are actual people that do utilize the CPAP machines at home. So much time was given to the questionnaire and the answer process. We took their suggestions and comments and changed the product to meet the general needs. It was pretty painstaking process, but well worth it. This product was actually born from an earlier version of the iLine. So Rob and I, we know the space and we wanted to solve that problem many CPAP users have. And that is the hose, the hose getting caught along the bed and the nightstand. So it tugs, it limits movement. It can be noisy when the mouthpiece breaks the seal and allows the air to escape. So this is our latest patent and soon will be assembled and ready for sale. And this product is business to consumer. So, you guys can find all of these products on our website, www.otenmedical.com, and you'll see better illustrations and more in-depth descriptions on each item.
Okay. Okay, well, that's awesome, the three products. I'm a biomedical engineer, so I do have experience on the hospital side, and I understand that from the problem perspective and finding a solution and developing the product and all of that, that's really great. What I wanted to ask you is, you already have all these years of experience in developing products, and it shows how the last one, the CPAP that you're going to launch next month, it's a completely different development process than the first one you had. So I would like to ask you from the first ones, how was the development process and how did you know what to do? I mean, you have the idea in your head. Do you know what the next step is? Did you seek outside help, or how was that process?
Okay. Well, the rapid prototyping, it was key. In the beginning, I had this misconception that I would have somebody make my invention, I would collaborate with them, and the process would be the most wonderful experience in the world. And that was not the case. I quickly found out. And in the summer of 2015, where I work, maker nerds from MIT visited us. So they came to a little city in El Paso, a little city in the edge of Texas, and I couldn't believe it. Well, there were the people that presented to us, they were there and met with all these nurses that came down and wanted to hear about nurse innovators. So I happened, and I'm not lying, I happened to have 2 copies of my patent on the remote diabetic monitoring system, and I shared with them the patent. So I did receive some praise and encouragement to start prototyping. I never thought of doing it myself, and my main concern was how to create the electronic and computing part of the project. So one of the presenters was a brilliant engineer from MIT that taught computer programming. So he helped me start with the software for my first device. And I was introduced to Raspberry Pi, which I later learned the basic coding skills on that. And, remember being a nurse for 20 years back then. Yeah, I never dealt with coding or prototyping of any large devices, but, I put my mind to it and I learned many tasks that were foreign to me. So, Maker Nerds did motivate me to put my patent into the works. And after drawing and much contemplation, I gathered some home devices and began building a large wooden box, drilling holes on top of the platform. And I built an electric blower into it. and was controlled with the remote control Christmas lights. You know, that's how basic it was with my first one. My patients' wound dilemma, I was looking at them on a daily basis and seeing that with my encouragement to see my idea come to life, you know, it was all worth it. So, and I'll do a quick story on the machine, on the device itself. I placed it in our bedroom, my wife and I's bedroom, and I tested how well my feet dried after each shower. So it lasted maybe 2 weeks before my wife kicked me out and moved it back into the garage. So I messed around with it for the following 2 years, and but the Maker Nurse's continuous encouragement had me making more prototypes, and each time my invention was becoming more of a practical device that I could see it working in the world. So I know you asked about seeking help. You know, Rob and I did seek out much help. We seeked out help from a clinical consulting device company for FDA approval process. We also talked to engineering firm for a team turnkey product development. So Rob and I quickly found out that the DiFOBot required a significant amount of investment, which we did not have and we still don't have. So we were already pitching to investors, which was difficult considering that, yeah, we were pre-revenue. So we're still continue to enter competitions, hoping to raise money for that idea and helping people with diabetes better take care of themselves. And, you know, these pitch competitions are frightening and intimidating, but you're placed in front of judges that determine who might get funded and solely judge on how well you present yourself. So that less than 7-minute presentation equates to the weeks and even months of hard work and getting to the PowerPoint or the graphs perfect for the pitch. And this doesn't include the work you have placed already on your business idea and the large amount of time, sometimes money that is included. You know, it's a huge gamble that is significant, and it is heartbreaking when it all comes crashing down, as many of you guys might know this very well.
Mm-hmm. Yeah, it does sounds like a complicated process, and mostly is you have this idea, this pretty big idea at the start, and as you go along and develop it, you realize you don't have the resources or the knowledge you need, and then as you seek it out, you start to learn what it is you need to seek. Like you don't know what you need to know, and stuff like that. How I would like to follow up with how was that different with your latest product? Like, was it much easier or was it completely different development process? How would that contrast?
Well, the 3D printing was very essential for rapid prototyping. You know, the dry lab space and here that we have here at MCA. And you know, fortunately with the eye-lines, we did it rather quickly. We got it so close to the manufacturing phase that, you know, with a 3D printing, that it was very easy, less costly. So the eye-lines were launched back in April. So, you know, we sold some to some hospitals already in the US, and we still continue to pitch to larger corporations. But the simplicity of it helped us to develop it much faster than the remote diabetic monitoring system. And that was the advantage between those two, that we did have the 3D printer available to us.
Okay. Well, that's, yeah, the magic of 3D printing. And it has helped a lot of entrepreneurs, innovators, startups, and all of that. So right now, you mentioned what stage every one of those products is. DiFOBot right now, it's still in development. The eye-lines are already manufacturing. You already have product orders and selling? Yeah.
So yeah, the stages on each of them is, well, the remote diabetic monitoring system is right now on hold. due to the nature of what we were talking about. But the other two are doing very well. We actually have been, doing leaps and bounds with them. But I'm gonna go ahead and give this one to Rob so he could also join the conversation.
Yeah, so kind of where we're at right now with product development. I mean, as you heard, we had to pivot a little bit. Um, the the Difobot is a big lift. You're looking at technology, you're looking at connecting, doing some machine learning, some AI associated with reading wound images. So there's a lot to that project that we just can't tackle right now. So we pivoted and decided to go the route of the eye lines for now. So the goal is to get some cash flow with that, and be able to utilize some of that cash flow then to help push the the Difobot development again down the road. So right now our core focus is on eyeline sales, both the eyeline and eyeline select, and then the upcoming release of the CPAP hose holder. So hopefully, we can check back with you in another quarter and give you some success rates on that.
Yeah, of course. So let's go back a bit. I want to take the conversation into more generalized on the OTEN and the startup culture that you have. So first of all, what is the end goal? What is the vision of OTEN? Because you have on one side, you have a consumer device, and another side, you have a business to business. You have something inside the nurse, the intensive care units and all that. So what is the angle? What encompasses all?
You want me to take that one, Ernie?
Yes.
So I think what was really important when we looked at our near and long-term vision and goals as a company is to be able to diversify a little bit, knowing that Difobot has a longer journey, kind of pre-revenue. The buildup for that is going to take a lot of cash flow, and a high burn rate for us, which we just can't sustain. So it was important to come up with these other products that we can push out to the market sooner rather than later. So the kind of the end goal, the vision for us, our mantra, our call to action has always been, patient challenges, nurse inspired solutions. We want to be able to see what the patients and the nurses delivering the care, what are some of the kind of roadblocks, hurdles, what are the pain points in their day-to-day practice that they're getting, so that we can help them kind of create a product that make life a little easier. So for us, I don't think there's a such thing as an end goal right now. Our focus is to continue to serve the patients better and the nursing care around them better. So I don't think that's going to change in the near-term future.
Okay, Ernie, do you have anything else to add?
No, we share the same vision. I don't think that will ever change. Being nurses, caring for people, wanting to make their lives a little easier with their disease process, getting to activities of daily living the best as possible, keeping independence. I think you look at all that and in the nursing aspect, and we're transitioning that to our business plan, our business goal, our mantra, like Rob said. We want to keep that and keep everybody healthy and well taken care of.
Okay, great. It's nice to see that the company is focusing on developing solutions where they are needed. And some companies that we know are just focusing on developing a product line. Like, this is what we believe, this is what we aim to fight or to solve, and then they develop that instead of keeping eyes open and not really compromising yourself to just one product line. That's a strong decision. But I like to see how both of you are in line, that relationship that you two have. How did it all started? How did you meet, and And most of all, like partnership questions, how did, for example, learning, how did you know that Rob was a good fit for the company? And Rob, how did you know that Ernie OTEN Medical was a good decision to bet on, to join?
All right. Well, yeah, we did a presentation with the city of El Paso back in 2018. We went to South by Southwest in Austin, and that's where I actually met Rob while he was working with Tupelo Life. So, as soon as we started talking, and this is Austin, so I didn't know Rob was from El Paso. So we just clicked. We started, we share the same passion for wound care. We matched our efforts with the remote diabetic foot monitoring, and Rob has been just an amazing asset in managing OTEN since we first started. Aside from both of us growing up in El Paso, we both are nurses, and Rob from the start had some unique skills that I needed to run the company, not knowing much about a business portion of it. So, Rob not only has his BSN, he also has his MBA degree. So I don't know that many people that have both degrees. So Rob takes care of the OTEN's business management and make sure we steer clear from errors. And he is instrumental in brainstorming product ideas, and handling international companies, reviewing our budget, and finding leads. So I really cannot imagine not having Rob with OTEN Medical.
And Rob, what about you?
Well, yeah, I mean, it was great. When I met Ernie at South by Southwest, I instantly knew. It's like this. I was like, I know this guy from somewhere, but it was just kind of like that feeling you get when you think you know someone from the past, but it just because we click so well. And he showed me what he was doing with the Difabot at the time, and I just saw a really good opportunity, in that space, coming from the telehealth space and the remote patient management space. I just saw that the need for diabetic foot ulcer is there. Work with so many hospitals and physicians that manage those type of wounds on a daily basis. Their costs are enormous, and the patient suffering is enormous as well. So I knew the opportunity was there, and I felt like, one way or another, I want to partake. And slowly we built our relationship, helping him out with little things like his presentation to investors, helping him out with financials, kind of projections, pro formas, things of that nature. That slowly, we kind of started just getting a little bit more comfortable, he with me, I with him, and it just kind of letting me into the OTEN Medical world a little bit more. And I felt like, he offered me an extended opportunity to join the team as a co-founder, and I was very humbled to take it on and help him out. So that's the short of a long journey so far.
Okay, I like it. There's the practical knowledge of, okay, if you're not sure with a partner for your startup or your company, you could like start working incrementally, a little by little, task by task, and then get to a point where you decide to go in at it completely. I think that's helpful for startups to keep in mind. So another question on your organization: how do the good ideas come from? How do you make the best out of your teamwork?
Well, we bring it to the table. We discuss it. We challenge each other if it's a good idea or a bad idea. What we do have is mutual respect for each other. We push ourselves. We question ideas. We have many late night calls, and we both give up a lot of our free time to work on OTEN, aside from our personal work schedule, because we still keep a full-time job. Each of us does. Each of us do. So we are open with each other, and even if it's the silliest idea, we still bring it up and talk about it. So I think that's how we we keep our ideas coming in, and what if this happens? What if we should do this? And we're very vocal with each other.
Yeah. Oh, that's great. That where you have an environment of respect, and you can openly challenge the ideas without harsh feelings, or without like being closed to those challenges. That really sounds very important, and it's kind of interesting to know how you got there, and that mutual respect, and that's the relationship building between partners. That's really great. We have a really good question on the chat. Uh, Christian wants to know what were the biggest challenges that you had of your startup journey. What were the biggest challenges? And I would like the extend it to what from those challenges, what were the biggest lessons learned?
All right, Rob, you want to take this one?
Yeah, I'll take it. I think there's a couple of big challenges. Number one is, that finding that work-life balance. As Ernesto mentioned, we got full-time jobs, and that's kind of my priority. So, being able to juggle that after hours, on weekends. But from entrepreneur perspective, and kind of like what you're going to be faced with, it's funding. That's been the heaviest challenge for us to date. Having multiple, first of all, getting to an investor, finding them, and then getting them to accept the call, getting them to accept the meeting, pitching to them, and then hearing yay or nay. Always very, very challenging. But what we've done kind of in light of that is just continue to find alternative sources of funding, right? So for example, Ernesto's been very active, not only there with the MCA, but also with the city, helping out, volunteering, things of that nature. One of the things that led to a lot of his networking was a grant that with the city of El Paso. So, kind of that's one alternative. Another alternative, Ernesto mentioned earlier, was entering competitions, pitch competitions. That's been very, very helpful as well. So lessons learned from a lot of this was look back and adjust your strategy. Look back and adjust your pitch for your pitch competitions, for your investor meetings. Self-evaluate after meetings. If you do it with your team, self-evaluate with your team. I have talks with Ernesto afterwards. We talk, and how do you think that went? What, I like this, I like that. I wasn't quite comfortable about XYZ. Okay, I think we need to do this in the near future, or let's adjust that presentation the way we presented that slide, for instance. A lot of things like that are really, really important that we address immediately afterwards, because if you don't, we'll likely forget, right? Because we're so busy, and I'm already forgetful as it is. So think like that we just got to be mindful about, that we've learned along the way, and then we ultimately address as we go along.
Okay, Ernesto, do you have anything else?
Yeah, I do want to add to what Rob said about the balance. The full-time job, the OTEN Medical, family life, it cannot tip. It has to be balanced, because if one area tips more than the other area, then you get in trouble. You start to get in trouble with the other areas that you're trying to balance. So that's a very good point that Rob made. We need to balance to stay healthy, not only as a business, but as your personal life as well. So, the grants, the winning contest, one thing that was common is that we didn't give up. We hit the brick wall with the diabetic foot monitoring, in sense of funding. We pivot. we maintain focus, we keep the business afloat, and staying stagnant is very detrimental. You cannot stay stagnant. It's the realization. Hopefully, ultimately, we'll get back to the remote diabetic foot monitoring. But right now we need to invest in areas where we're going to be successful, and allow other ideas to manifest with a positive outlook, and see them come to life. And I think being versatile, having that flow within your business organization is important, and mutual respect with each other, and helping each other see that, hopefully we'll get to that point. But right now we need to focus on other areas. That needs to be, said and understood from the get-go.
Okay. There's another point that you haven't mentioned yet, and Kathy Chen was wondering about it. She put the question in the comments, and she asked if the doctors and administrators you work with were supportive of your work outside the hospital or clinic. I mean, that brings up an important point. You've talked about the challenges of internally, but what about external?
Right. So it's a very good question. And I pitched to everybody. So I pitched to the largest renal dialysis group in El Paso. I pitched to, of course, investors here in El Paso. And it was difficult in the sense where a lot of them do understand the disease process. They understand what needs to be fixed. But, getting them to invest in you is challenging because they don't want to lose their investment. They want a quick return. They want you selling already. They want to see your sales right now. And as a startup, that's close to near to impossible if you don't have the product already established where you want it to be as a turnkey, product already. So I did mention it to them. They were very supportive. They agreed. They gave their input. I even had a doctor. I was dialyzing this young lady that needed remote monitoring for her diabetic foot ulcers. And he looked at me, he goes, "Where can I write the prescription for this, Ernie, so I could get one of your devices for her?" And I'm like, "Well, hold on, doctor, I'm not even there. I'm getting there, but it's still gonna take a while." So they understood, they really understand how much, the devices are needed. So now with the eye lines and the CPAP host holder, I get a lot of those, like, why didn't I invent that? That's great. Why can't we get these in already? Let's bypass all the red tape at the hospital. But unfortunately, that's not how it works. You need to go through a lot of committees in order to get the products into the hospital setting. But I did pitch. I did, and receive support from externally from my colleagues and professional friends.
Okay. Well, yeah, that's a very good answer, insight into when you really do have a solution to a very present problem, everybody just jumps at it and instantly recognizes the value of it. And yes, I guess it's a good measure that the more people ask themselves, why didn't I invent that? That it's the most ingenious device, the most ingenious innovations, right?
Right.
So I would like to ask now and have this conversation with you. We're nearing our end time. So personally, what would be most important to you? The core values, the mission, or the vision?
Well, I'll go first. I think for me, it comes down to values. For me, the underlying value has always been do right by the patient. So if we do right by the patient, the profits in the business will follow. So it's all about solving those issues that patients are faced with on a daily basis. Diabetic foot ulcer, ideal situation, right? Ideal example. We're trying to do right by helping them, identify, know that they have a wound ulcer to begin with without having to wait to smell it. By then, it's way too late. So inventions and innovations like this is what's going to help people from any perspective lead a healthier lifestyle. So for me, the value of developing something that's going to make a difference in someone's lives is most beneficial.
I agree with Rob, and that's why we're partners. Seeing, to me, the core value is seeing what's most important is to see my patients live a healthier life, and helping people handle their daily healthcare struggles with more ease is important for Rob and I. And this applies to all aspects in life, and having a mutual respect as a human being. Respecting others and wanting others not to harm others, wanting others to succeed and to live healthier. That is our core value for OTEN Medical. You're on mute, Alberto.
Sorry about that. I was just saying that that's very refreshing to hear a value-focused company, not necessarily a goal or an action, a mission driven. It's more about doing the best that one can do on wherever one can do it. We have another question from the audience. Luis Chavarria asked, how have you learned about regulatory requirements for medical devices?
Do you want me to take that one?
Yeah, go ahead, Rob.
Yeah, so a lot of research. I think a variety of ways that we kind of ran into best practices. First, of course, Google. Go in there and identify and go through the FDA.gov. Not always the most fun or easiest websites to navigate, but you'd be surprised the number of people out there as an alternative that can be very helpful. So, reaching out to local consultants that do FDA work, talking to them about what you have in mind, what it would take. Many of them are going to be very kind enough to have an intro call that you can take away a lot of good perspective and valuable information that will make your hunting online so much easier. So, that would be kind of my recommendation in terms of some of the best practices, so you can identify, hey, what kind of regulatory requirements does my device or my idea have to have? I would start there.
Okay. Well, that's great. Now, any advice, any pieces of wisdom that you could share to entrepreneurs or even nurse innovators that would like to start in their solution seeking journey and innovation journey?
Right. The advice would be to seek out help, seek out institutions, and leading to our success has been working in parallel with the MCA. We've been privileged to work with MCA Innovation Center, part of the Startup Developing Program. Coming from a nursing background, I go back to that. The business training MCA provided was essential to understanding how business works, establish vital contacts where local resources otherwise would be extremely difficult to find on my own. So having MCA accessible has allowed us to stay in El Paso, still remain competitive in the innovation comparatively to the larger cities. So we were able to occupy a modest amount of laboratory office space, grow over time in space, saving our company, the large outlay of the operational funding that would otherwise be, required during the startup period. So, saying that, we are eternal grateful for what MCA has given us. Now, with your own drive, wanting to make a change, I think that should be your core mission, not per se following the financial gains, monetary gains that you're going to receive, but if you're going to be concentrating on that, then be running a medical company is not, should not be part of your what I'm trying to say is that your values should be more focused on helping and improving, and everything else follows after that. So I think that would be the greatest advice, and one word sums it all, and that is persevere. Persevere through struggles, through bumps on the road, because you will hit a bump on every step that you take with a business, and just persevere and don't give up.
Okay, that's awesome to hear. And just to, we're 2 minutes out, a couple minutes out from the end of today's session. Just before we end, you right now, OTEN Medical right now is working with the Innovation Center at the Medical Center of the Americas, and Nurse to Innovator program. Would you like to talk a little bit more about that?
Yes, so we were invited to partake to the Nurse to Innovator program, seeking out nurses that are creating on their own and not really having a guide to take their idea to proof concept, make it something tangible. And that's where we're doing an outreach for local communities here in El Paso, Juarez, Las Cruces. And it's a great program in order to get their ideas out in the open. Not only that, but also improve our current healthcare delivery. There's always room for improvement. There's gaps in the system that need to be filled in order to better serve our population. So the Nurse to Innovator program is essential in my eyes, that to improve our local economy, not only in bringing more or creating businesses here in El Paso, but also make our name, make our the city of El Paso stand out. So I'm very proud of the Nurse to Innovator program that I'm participating in with MCA.
Yeah, I would like to add that, yeah, the Nurse to Innovator program is a binational program. We're working on both sides of the border, trying to connect nurses to innovators. We're lucky to have Fab Labs on both sides, Fab Lab El Paso, Fab Lab Juarez, have joined the program to help do all this rapid prototyping for the nurses, for entrepreneurs. So if anybody in the audience has any questions, please reach out to Nancy Laurie. She's the director of the Innovation Center. She just typed in her email address in the chat box. And if nobody else has any questions for Ernie and Rob, I would like to thank a lot everyone for joining the talk, and especially Ernie, Rob. Your story is very interesting. It's very inspiring. I hope that a lot of people take this inspiration and really go with it to find out that as long as the core values, the helping others, and really hoping to solve patient needs, as long as that is in place in the center of everything, the business side will come. There will be people to help out, people that to mentor, to guide you in the process. So thank you very much, Ernie, Rob, and the MCA for this space.
It was a pleasure. Thank you.
Thank you for having us.
Well, to everyone else, we hope to see you in the next Tech Tuesday on the February edition. Thank you all, and goodbye.
Good night.
Thank you. Thank you, Ernesto. It was very good.
You're welcome, Nancy. It was fun.
No, this is Michaela. I just
Oh.
say congratulations, Ernesto, on getting some actual sales going with your two products, and good job. Congratulations.
Thank you.
But I think the same thing, Ernesto, okay?
Yes, I know.
Okay. All right.
All right. Bye, guys.
Bye-bye. Thank you all for attending.